other thing I wanted to answer, going back to your question, Brooke, was you might separate like upper back versus low back too. So how would you drape specific to get the upper back? How would you drape specific to just get the low back? You don't need the whole back exposed if you're only doing one or the other. So keep that in mind too as you're practicing. Okay, and that kind of goes back to the draping from 150. You only need access to the area you're treating. So. All right, so let's go ahead and move on. Actually, one more thing before I move on. I did want to talk about during this week here. I did not have it on here, and I don't even have it like official yet. But we always have you guys do the challenge course. Have you seen it? It's super fun. But I try to set it for morning, and I am choosing to do that Friday morning, so the 21st. So I wanted you to be aware, they haven't gotten back to me to say, yes, we're scheduled. But I want you to at least know that that could be coming, so you have it in your schedules. It would be set for 8:30 till around 11:30, so we try to get it done early in the morning before it gets too hot. But you do also do that with the online students, so it's kind of a team building type experience. It's usually a lot of fun. It's not the high challenge course, it's the low challenge course, so you won't be climbing up and getting all like rappelling or anything. But mark your calendar for that too, and I'll let you know when it gets more officially set. Yeah.
And you said it might be tentatively 8:30 to 11:30?
Yeah, okay. About there. And that was the 21st.
That's a Friday.
It is a Friday. Okay, so let's go ahead and get into respiratory massage. I don't know, I did change something in the notes yesterday. It wouldn't have mattered if you printed it prior, but I do think that the picture, I changed the picture, and I think it's a little bit better view. I am gonna give you the picture though in a handout I have for you. So if you printed prior, then it's okay. It's just a different view of the lungs on the section 5.2. So if you printed just before yesterday, you probably don't have it. But the picture that I added is in this packet I'm going to hand you today, and it looks like this. So you'll have access to it, at least this way. Okay. All right, so getting into respiratory system. So the respiratory system, what you have to know about it is kind of the function, how everything kind of works together. So how we breathe in. So we breathe in air through our nose. It goes into the nasal cavity, and actually let me just show you the picture as I'm starting to talk about this. Through the nose, goes to the nasal cavity, the pharynx, goes down into the larynx, through the trachea, all the way down here, and then it starts to branch off into these bronchial tubes, and then it goes into the lungs where it has the bronchial trees, and then it goes off from there to these like thin air-filled sacs. These alveoli. So that is where gas exchange takes place. So you breathe in the oxygen, goes into the alveoli, and then that's where it kind of gets dispersed to the bloodstream, and then carbon dioxide comes in and is exhaled. So it's kind of the general view of the respiratory system. Now we don't get into like a ton of detail, so we're not respiratory therapists, but you still have to have a general understanding of how this all works. So kind of the main things, anatomy-wise, that you have to be aware of is kind of what we just referred to. So breathe in through the nose, here's the nasal cavity that sits here, runs down through the pharynx. The larynx is not identified on this, but it runs right here. It just doesn't have a label. And then it runs down through the trachea, and then to the bronchial tubes, right? And then through these bronchial trees, and eventually leads out to the alveoli. So other things to kind of keep in mind is external respiration, internal respiration, and cellular respiration, also known as oxidation. So exchange between the outside environment, what you breathe in, and then where it kind of mixes with the blood. So it transfers into the bloodstream, and then carbon dioxide kind of gets expelled there. But it's just the act of that external environment in the blood, that transfer that kind of takes place. That's external respiration. Internal respiration is more talking about that gaseous exchange, so more specific. And then cellular is occurring inside the cells. So it kind of breaks it down, each task more and more. And then this part here, I kind of just explained what that was, how things kind of run through. It's just kind of the written description of the same thing I just showed you. So running through the nasal cavity, down the pharynx, larynx. That's all just written right here. So a lot of words on the page for something I just explained. So one other area I want to show you is just this little animation, which is exactly what I just said, just kind of in a visual format. So I'm going to show you that real quick. It's not very long. Is this big enough, or should I expand?
Air first enters the body through the mouth or nose and quickly moves to the pharynx or throat. From there, the air passes through the larynx or voice box and enters the trachea. The trachea is a strong tube that contains rings of cartilage that prevent it from collapsing. Within the lungs, the trachea branches into a left and right bronchus, which further divide into smaller and smaller branches called bronchioles. The smallest bronchioles end in tiny air sacs called alveoli, which inflate during inhalation and deflate during exhalation. Gas exchange is the delivery of oxygen from the lungs to the bloodstream and the elimination of carbon dioxide from the bloodstream to the lungs. It occurs in the lungs between the alveoli and a network of tiny blood vessels called capillaries, which are located in the walls of the alveoli. Here, you see red blood cells traveling through the capillaries. The walls of the alveoli actually share a membrane with the capillaries. That's how close they are. This makes it possible for oxygen and carbon dioxide to diffuse or move freely between the respiratory system and the bloodstream. Oxygen molecules attach to red blood cells, which travel back to the heart. At the same time, the carbon dioxide molecules in the alveoli are blown out of the body with the next exhalation. Gas exchange allows the body to replenish the oxygen and eliminate the carbon dioxide, both of which are necessary for survival.
Any questions on that? So that's kind of the basic understanding that we're going to have of the respiratory system as far as how it flows. The next part here we're going to get into, and this is where I changed that picture. So this is the picture I added. I felt it was a little bit more, it explains the lobes a little bit better. The other picture didn't really show it as accurate as I wanted it to. So again, not that that picture is bad, it's just this one kind of breaks it down a little bit better. Okay. So the lungs is what we're going to be talking about here, and kind of the anatomy of the lungs. So located on both sides of the mediastinum, which is kind of down right here. So there are the two different sides, right lobe and left lobe. So the right lung and the left lung. Lobes are what I'm getting to next. So the right lung has 3 lobes to it. So it has the upper, the middle, and the lower lobe. Okay, and then within those lobes, there's all kinds of sections. Now, I would not expect you to go into a ton of detail to identify where these are. I just wanted you to at least see upper, middle, and lower lobes there. When we start talking about these, apical, anterior, posterior, that kind of relates to what we're going to be doing a little bit in lab. So you'll see it, but I wouldn't ask you in a lecture exam to identify those specifically, unless it relates to your lab portion, which we'll talk more about later. Okay, so the left side has 2 lobes, so there's the upper and the lower. The one thing I do want to point out on the left lung is this part right here on the very bottom that sticks out. So let me use my little mouse because I don't want to block everybody. Right here, that is the lingula. And so that is known as the tongue in the lung. So it looks like a little tongue. So I do want to point that out. But there is a lingular division, and that does relate a little bit to what you're going to be talking about in lab 2. So just wanted you to be aware of that one. So surrounding the lungs, there is a pleura, kind of the visceral pleura that is like a fluid, kind of, I shouldn't say fluid filled, because it can get fluid filled, and that's not a good thing. That's where it turns into like pleurisy or an abnormal respiratory condition. So, but it does surround the outside of the lung, so you should be aware of that as well. And that was shown a little bit in the other picture. This one doesn't show it as well. So, moving on from there, getting into breathing. And what is breathing? Breathing is also known as ventilation. So we already kind of discussed what that is. So as you're sitting here, breathing normal, we'll talk about the type of volume that you're using in your lungs. But with normal inhalation, exhalation, what do you think happens as far as muscle contraction with inhalation? Do you know? So, okay, good. Intercostals do what? Yeah, so that's good. So intercostals kind of lift the rib cage, and then the diaphragm, which I heard as well, compresses down, right? So it opens up the space of the lungs to allow for air to fill the lungs, right? And then as you kind of exhale just without force, what's happening? Are you using muscle control? No, it's just relaxation of the intercostals and the diaphragm. So everything kind of closes back down, like it comes downward here and the diaphragm comes back up and it kind of releases the air. Now as you get into forced exhalation, then there's more muscle involvement. So we'll talk about that. So forced exhalation is active contraction of the internal intercostals. And then we talk about like collapsing of the rib cage as well. So forced air out of it. I do want to get into, some of this starts getting into a little bit more about what we're going to talk about next. So I'm just going to scroll down. It does kind of make sure to keep in mind keeping healthy lifestyle. So if you ever have a patient that is a smoker, do you think it is your job to talk to them about smoking cessation? What are your thoughts as a PTA? Yes, it is. So, and I know it's kind of one of those things that's more of an uncomfortable conversation, but you should always be talking to your patients about lifestyle changes and what's good and healthy for their body. And so, smoking cessation, if you hear some that, like in your lab exams or anything in the future, that should be something that you're giving patient education on to keep healthy lungs, okay? And that it'll maximize the exercise that they're doing in therapy as well.
So without just like for future purposes, if we are with a patient in a clinic and we're talking to them about that, I know you probably want to be like as professional as possible, but you don't want to make it like a long conversation. So is it just like, you really need to stop smoking?
Yeah, and most of the time, honestly, like I've had to say it to patients many times, and they're like, yeah, I've heard it before. But you just want to make sure that you're saying, like maybe you're going to be the one that breaks through. I don't know. Most likely not if they've been doing it that long and they're like, nope, I'm going to do this. It makes me happy. But at least you could say, this is the purpose why I'm saying it to you is for this, the PT side of things, not necessarily the respiratory side of things or the nursing side of things. Like everybody's going to do it in their own way, but you can give kind of your, because maybe that'll be what they really want. They want to start building muscle and getting stronger, and that's going to help them get there. So, but obesity is another thing too. That's kind of an uncomfortable conversation, but that should also be something that should be discussed. And of course, that one requires a little bit more like sensitivity, to how you approach that. But healthy lifestyle changes, like the heart. And we'll talk about like cardiac or cardiopulmonary at the end of this class.
Um, I realize it's not the focus of but what about vaping?
Yeah, same type of concept there for, it would be exactly, that's probably more common now. But yeah, that would be the same. Okay, so, this next part here, we're getting into, this is kind of talking about descriptions, like what this all means, and then I'll go into the chart below to explain it a little bit further. So if you're like, what are you talking about? I'll talk about it again here in a second, okay? So these terms, and you've probably seen these in the abbreviations, right? These total lung, okay, at least something sounds a little bit familiar. So total lung capacity is referring to the amount of air that can be held in the thorax. And I'll talk about like the little formula there. It's just talking about some of the rest of these terms. I'll talk more about that in a second with the chart. The tidal volume is the amount of air you're breathing in and exhaling, kind of just sitting here at rest. Inspiratory reserve volume is the amount of air you can inspire after you're sitting here at rest and you want to take like a bigger breath. That would be that portion, is the excess inspiration. Okay? Expiratory reserve would be the same thing but the opposite way. So if you've just exhaled your normal resting exhale, but you want to do a little bit more, that would be when you're getting into the expiratory reserve volume. Residual volume is the amount of air that's kind of left in the lungs after you've exhaled. That expiratory reserve that I just talked about, there's a little bit more in there, and that always stays there. The lungs are never completely emptied. Okay. So inspiratory capacity is talking about the amount of air from when you're sitting here until like you've inhaled all the way. And I'll show you it on the chart. I think it's a little bit, I'm like doing the chart right here. Anyway, I'll show you it. I think it helps to see it a little different. Functional residual capacity is talking about what's your exhalation, like what's in the lungs, you push the air out, and then what's still left in those lungs. That's your functional residual capacity. And then your vital capacity talks about the greatest amount of air that you have where you're in. Let me just say it how it is here and then I'll show you. The amount of air exhaled from your full inspiration or the amount of air inhaled from your full exhalation. And I'll show you that on that chart. So just understand at least what they mean for now. And then of course the abbreviations will help to look at the chart a little bit better and make sense of the chart here. So I don't know if this will work for you or not, but this has always helped me to see it like this. So I'm going to try to explain it. Martina's like, you're crazy. So right here is the tidal volume. And this is just you sitting here resting. So it's your inhalation, exhalation, just as you're resting here. Okay? So that is your tidal volume. And then as you're sitting here and you're breathing in normal, you're inspiring, exhaling, whatever. Then you go and decide to take a deeper breath in. This is where you get into your inspiratory reserve volume, okay? And so once you've completely inhaled, and then you go and blow all of that air back out, so it's gonna take you back down to here, but then you wanna push a little bit more, then you're getting into your expiratory reserve volume, okay? So, and then what's left in your lungs, because like I said before, it's never completely empty. What's left in your lungs is the residual volume right here, okay? And so with that extra exhalation and what's left in your lungs, that is considered the functional residual capacity. It's right down here, okay? Now, the last thing I wanted to show you though is your vital capacity. So as you inhaled all the way and then fully exhaled as much as you can, this is your vital capacity. That's really what you can control of how much your lungs fill and exhale. Okay? And then all of these things go to the total lung capacity. So everything together, and the total lung capacity is going to show on the end there. But at the very bottom of your notes, I want to show you where it says, this is kind of the best way to think of what is the total lung capacity then. formula at the top where it showed it, it's best to look at this right here. So if you think of the word liter, so the L is talking about the lungs, so total lung capacity, so all of it, is the inspiratory reserve volume plus the tidal volume plus the expiratory reserve volume plus the residual volume. All of those things equal your total lung capacity. Does that make sense? Does the chart make sense? Review it at least. Are there any questions? Okay. Now, again, this is all the words right here for what we just talked about. So if you're more of like, oh, let me read through it, it'll make more sense if I read through it, then it's just there in that format. Okay. So these next sections I kind of discussed already when we went through massage stuff last week. So I'm just going to kind of go over quickly before we can get into lab. So respiratory massage is also known as chest therapy, and it's used to help clear mucus from the lungs. And so a lot of times you'll have like somebody that has cystic fibrosis and they're constantly getting mucus in the lungs. They used to require parents to be doing this chest therapy all day long, like it was consistent. Now they have what's known as a chest vest that a child can wear, and it's constantly shaking, and so that's what's doing the manual stuff in a different way now, so that parents don't have to be directly involved in that anymore. So it's a huge help to parents or anybody that required it like long term like that. And it was consistently throughout the day that they had to clear the lungs. So chest vests are great. But anyway, the reasons behind why we would do something like this is one, relaxation, so it can kind of provide some relaxation for them. There's a lot of anxiety that builds up when you can't breathe, right? I mean, you probably feel that when you get sick or something and you're like, oh, I can't breathe. Imagine if it's like that consistently. So this kind of helps to provide some relaxation. Airway clearance, of course. Postural drainage, which will show specific positions on how to do that. The percussion techniques, and so this is where we're going back into like clapping or the cupping type percussion, like your tapotement. And then we'll get into vibration and shaking techniques, and that's what helps to really like get rid of that mucus. So you might do these in combination with each other, and I just want to show you. So if I'm doing this and going on somebody's skin like this, what am I doing? Cupping, right? Or clapping, right? I think it was, we talked about both. So if I'm doing that first, what that might do is help to break up some of that mucus that's sitting in the lungs. And then as I move into like vibration and shaking, that's kind of in combination. And then they're doing like a hissing sound that's really going to help move that mucus. Okay. Now the patient has some involvement in this as well, and that's where we get into deep breathing and coughing. So you're going to ask them to take a deep breath in, and then you're going to start getting into these techniques where they're breathing out as you're doing it. And then at the very end of it, they're going to cough. And by coughing, that's going to try to get rid of what's left in their lungs. Okay. So let me kind of move down. That kind of just went into some of the same information I just told you. So right here, this is kind of how you might do this sequence. So you want to position them appropriately. We'll, a little farther in your notes, you'll see a picture of this. Position them appropriately, and you're really positioning based on the bronchi, like you're trying to get it perpendicular to the floor. So some of the positions look a little interesting, but you kind of, let me just scroll and show you. Actually, you guys might see it in your notes. It's this picture that I'm going to be referring to. Actually, I'll just scroll down. I'll go back up. Okay, so as you look at this, you might see like, here's a picture of the bronchial tubes and trees. So this is what you're trying, this particular segment, which is what we're trying to get. You want to get that patient to where there's position like Trendelenburg, pillows just right, where I'm getting this perpendicular to the floor. And that's the purpose behind positioning them in these different ways, is to try to get that as close as you can to perpendicular. Now, it doesn't always work out that way, where you can. Now, imagine a patient, if they're having a hard time breathing, they definitely don't wanna lie down with their head down. So, that's really hard to get there, so you're gonna do your best to get as close as you can, if the patient's taller, or if they can tolerate it. So, let me scroll back up to where it was. So you position them, if you can get them there, and have them stay in that position for about 10 to 15 minutes, where it would start just draining, okay? Then you would start to use your techniques, like your percussion, and then get into your vibration and shaking. And then having them go through the coughing, or deep breathing and coughing with that. And then have something nearby where they can spit, okay? Whether it's one of those little, I forget what you call them, they can give them to you at the hospital, a little basin or whatever, or a towel or something, trash can. And then you go into repeating that same cycle. Okay? Now, it's not often that you would be doing this as a PTA, but it still might happen, so that's why you need to be aware of it. Plus, it's on your board exams, so. Okay, so any questions so far? All right. So, kind of talked about that information there. So this is what we're gonna get into in lab. So I do have, I'm gonna have you guys kind of set up as stations where we run through each of these, and I want you to really think about positioning your patient. And I'll show you one before you get started on it. But I want you to think it's all about positioning, really. And then once you find that segment that you're gonna be working on, so if you see here, it says upper lobes, apical segment. That's what I have on here. And then I'm telling you exactly what I want you to do for that particular thing. Now, all of them will have the same portion of what you have to do, but the positioning part is really what I want you to take away from what we're doing. You can do the technique, and you're gonna do the technique the whole time, so that I think will come, but it's the positioning that you just need to try to make sure you hold on to that information, okay? So in case you're like, what is this referring to? Upper lobes, apical segment, that's talking right here, and this is the position for it, okay? So we'll go through this a little bit more. So there are 9 different positions there. I think I'm gonna skip this part, because this is what I'm gonna show you in lab. But this just kind of goes over the technique of it. We already kind of went over what the percussion techniques are with cupping and clapping. So it's just going into it a little bit more detail here and how you're gonna go about doing that. So when we're done in lab, you can always refer back to this section, okay? And then vibration and shaking, it kind of has the same thing, kind of lined out how we're gonna go about doing that. And then deep breathing and coughing, and I'll demonstrate that as well for you guys. The last section, a lot of this will be familiar from what we already discussed last week, but indications, we kind of talked about why you might do this for chest therapy specifically. So this would be people that have respiratory conditions where there's a lot of mucus that's building up in their lungs, and you want to expel that mucus. Keep in mind too that infections would be associated with this, so the mucus, this is why I'm not a respiratory person, because it would be really disgusting. So, but it can be, it's different colors and things too when it's infected, so. Precautions, these are things to keep in mind with going into those various positions. So it's not necessarily with precautions that you can't do it, you just need to be aware and careful. So supine positions, of course, you need to be aware of circulatory issues, congestive heart failure, they have hypertension, pulmonary conditions, like if they get short of breath, you just have to keep that in mind, especially going into Trendelenburg, and that's what this is referencing specifically. Abdominal things such as obesity, distension, like if they have a hernia, and it does talk about like if you've just eaten, like and you're laying down, like with your head in Trendelenburg, it's really not comfortable for most people if you've just eaten, so they're more cautious of that, we can get nauseous too. Sideline positions, when you're getting into a sideline, this is just, I'm not gonna get into too much detail, but axillofemoral bypass graft, it kind of runs down the side from axilla to femoral. So that is something that if you're laying directly on it would not be something you would really want or need to be really cautious of. Other things would be musculoskeletal things, so thinking about recent rib fractures, which could be a contraindication depending on how severe it is. Bursitis, tendinitis, just, that's something like when we talk about like, oh, roll on your side, and you know they have an injury, it's really uncomfortable for people. So it's the same type of thing, to just be aware of that. And getting into contraindications. So we kind of talked about these last week, because it was under that section, in that chart, remember? Okay. So severe rib fractures where it's flail chest. Do you know what flail chest is? So when the rib is kind of free, can puncture the lungs, you don't want to be hitting them to make it puncture the lungs. Acute heart failure, and this gets into like embolism, thrombosis, things like that. Severe hypertension, I don't think I need to read these off to you honestly, so just wanted to go through what they are. So any questions on this section? Okay. So why don't we take a break so I can see some faces getting extremely tired. I want those to change before we go to lab. So meet back in the lab at 9:45. Big lab.